Okay, hello, this is Jessica Lohman, and I am with Steve and Tacey. We're both medical reviewers for Workers' Comp Division, Medical Resolution Team. We're going to talk today about Oregon workers' compensation for chiropractors. So specifically, Workers' Comp 101, medical billing and payment for chiropractors. So our agenda includes an introduction, overall just general information about workers' compensation, kind of how claims adjuster may manage a claim, the medical resolution team, and what we specifically do as medical reviewers. If you are a attending physician, chiropractor, we're going to talk about how to become that, what you need to do, how to help the worker file a claim, manage care organizations and claim management once the worker is treating with you, how to make referrals, and most importantly, how to make sure you have WCD or Workers' Comp Division certification, which would allow you to get paid on a claim. We're also going to talk about Billing 101, the billing form, the HCFA or CMS 1500, timeframes and appeals, and how to get to and find the Oregon fee schedule, which is what you will use for billing. Okay, first off, medical resolution team and what we do. So we handle disputes related to workers' compensation billing or medical fees, medical treatment disputes, such as those that may occur when the insurer does not approve palliative care, curative care, elective surgeries. Maybe the insurer denies a worker reimbursement or anything along the line related to workers' comp and a dispute. And that would include the managed care organization disputes. So there are a few different ways that we actually handle disputes, and one of them is through an alternative dispute resolution process, and one is through formal reviews. So the ADR, or alternative dispute resolution process, is one where we attempt an informal resolution. So basically we have a person that handles those disputes, and the turnaround is typically, say, 3 to maybe 7 or 9 days. And that involves just sending an email and usually being able to resolve that dispute without writing an order, or sometimes there might be a stipulated agreement that is signed, but generally it's just the insurer agrees to make payment on a billing issue, for example, noting that it is due. So the other way that we handle disputes is through formal review. And these can also result in a stipulated letter of agreement, a general letter, or an actual administrative order that is legally binding. So once we do write an order, if that's the case, you have 30 days to dispute that order if you don't agree with the outcome. In order to actually file a dispute with the medical resolution team, which you may or may not have to do during your tenure, is using a Form 2842 and or 2842A, which gives more information on the specific bill you might be disputing if it is a payment dispute. You use that form for all the different types of disputes, so just make sure that it's really clear, everything is written in that you need to let us know. Okay, so this next slide, we're going to talk about general information about workers' comp. So as you can see from the www.oregonwcdoc.info, that is the page that you're going to want to go to if you're looking for any information. So this will tell you, as you can see by the headers on the side, it'll provide some resources. If you're new to workers' comp, it'll give you some tips and things that you have to do there. If you're not familiar with 827s, which is the form that a worker would complete at your office, that would either signify the opening of a claim or a change of attending physician, or various other aspects, you can watch this video here on Form 827. There are some provider handbooks, healthcare provider actual other information, workers' compensation terms. So if you're not familiar with the IMEs, ADRs, what else is there, Stephen? Let's see, ARB, so arbiter exams. Let's see, we also use physician review, PCE, those kind of things. Opioid guidelines and calculators, return to work information, and opioid dosage conversion. So as you're aware, the opioid crisis is pretty real, so please feel free to go there and look at that stuff before prescribing the opioids to make sure that you're doing things the proper way. Okay, so the Workers' Compensation Division, our goal is to advance leading workers' compensation system that represents integrity and fairness for Oregonians. So in Oregon, filing a workers' compensation claim is the exclusive remedy for workers injured on the job. In the event of an injury, a worker may seek treatment at any provider of their choosing, and in fact, the insurer cannot force them to go to a specific provider. So if the employer wants them to go to a clinic, say Concentra or something, and they want to go to a chiropractor, they're more than capable of doing so. They just have to initiate that. So one quick tip, the Workers' Comp Division is not Safe Corporation. So Safe Corporation is an insurer, and what we do is regulate insurers. So we are not Safe Corporation. So when a worker is injured, they would complete a Form 801, which is a standard form that provides all information regarding the injury, the rate of pay, the job, where they treated, etc. And the provider would not have the 801, the actual insurer or employer would have that. So another way to initiate a claim is to go to the medical provider, which would be you, and complete a Form 827. We're going to get more on 827 soon. So at a first visit with a new patient, first there are some basic questions that you should make sure that you have answered so that you know whether or not you can treat them or you have to get pre-approval or what else may need to be done. So when a patient first visits a doctor, the basic questions could include, is this a first visit, follow-up, or referral? So if it's the first visit, you need to complete the 827 form, which you should have in your office. And if it's a follow-up or they're seeing you on referral, hopefully there will be some documentation to show that. And they can follow up with you as a chiropractor if they choose to and change to have you be the attending physician. But again, you're going to need to fill out the 827. So always refer to the 827 to make sure there is, that everything on there is filled out appropriately so the insurer knows what's going on. You also want to ask if the worker is in a managed care organization, and that would be Majora's, Providence, Kaiser, managed healthcare, which is also Caremark. So you want to know what the claim status is. Is it closed, open, deferred? If it's deferred, just keep in mind that although you're going to continue to bill the insurer for that visit, you're actually not going to get paid until a claims decision is made. So if it's an acceptance, then they'll pay the bills that are in the file at the time of acceptance. If it's a denial, you'll get a letter that explains to you, that's basically copied the denial to you, and then you can go ahead and bill the private insurance if that's your procedure. Are you credentialed by workers' comp? If you want to get paid, you need to be credentialed. And I'll cover this on the next slide, but that's very important. You need to also have enough information in order to bill the insurance company. So you'll need the claim number if the worker has it, the name of the insurer, the date of injury, etc. And if you have any policies, say for no-shows for appointments, at the first visit, it's a terrific time to review those policies with the patient. We'll talk more about that later as well. So let me see here. On the first visit, you have to notify the worker, in writing preferably, that they may have to pay for medical services that are not covered. When you provide medical services to a workers' compensation patient, you shouldn't bill the patient for any services related to an accepted compensable injury or illness unless these 5 things apply, or one of the 5 things. And they are, the patient seeks treatment for conditions that are not related to the acceptable condition or injury or illness. So if you have a patient, which we just saw for this the other day, where the worker is in there for a low back claim, and they keep bringing it back and saying, well, my wrist hurts as well. If the wrist isn't part of the claim, you're not going to get paid to treat the wrist. So make sure that you're focusing on the body part that is actually injured or part of the accepted claim. So if the patient has been enrolled in a managed care organization and seeks treatment from you, and you're not a panel provider for that MCO, you may not be paid. So you need to make sure that you're asking every time if they are in an MCO, and again, that's managed care organization, and that you are a provider. You can get a hold of MCO information on our website. There'll be a link to that on that first page that you went to. It'll show you the different managed care organizations and how to contact them. So if you aren't a provider for them, you can always contact them and see if you can become one. So the patient seeks treatment after having been notified that the treatment is experimental, outmoded, unscientific, or unproven. So if the patient comes to you and there are certain things that workers' comp doesn't cover, one of them would be like cryotherapy. So keep in mind that you're up on those rules. And if you have any questions about what is or isn't covered, you can always call the medical resolution team or look in the rules and statutes. So if the patient seeks treatment for a service that has not been prescribed by the attending physician, and you're not the attending, you're just seeing the patient on referral, then there's a chance that you won't be paid. Or if the patient seeks palliative care after it's been disapproved by the insurer or director. So in workers' comp, any palliative care, which would happen after the claim is closed, has to be approved. So keep that in mind. Okay, so this is you've probably all seen this. It's called an 827 form. And there are different times when you would use this. You're not going to use it at every visit. So like I said earlier, if it's the first visit, you would check that first box, first report of injury. And the worker is actually going to fill out this portion that's in the orange. And then you are going to fill out, as the provider, the part that's below in the gray. So, and they are also going to fill out their name, or you can help them with that. So if you're the very first healthcare provider, then you're going to complete this form. You have to send this form to the insurer within 3 days, according to the rules. And you can also use this form to request a new or omitted condition. And you can see that right there on the second box in the orange. You would check that box and then write in what the condition is. Keep in mind that you cannot, or the insurer generally is not going to accept pain. So you don't want to write lumbar pain, but an actual diagnosis like a strain or herniated disc or something is totally fine. If the worker came to you and they want to establish care with you as the attending, then you would check box 3 there. And sometimes reason for change could be something like, seeking a different opinion, going to a specialist, whatever the case may be there. And then the last box in the orange section is about reporting an aggravation. So if the claim has been closed and they're seeking treatment, they're going to go ahead and check that box.
Any of these 4 boxes are going to require a signature right here from the worker. So this is a form you're going to want to fill out during your visit with the worker and have them sign it if you're checking one of these boxes.
Okay, so do not ask the worker to sign Form 827 if it's just a progress report, or if it's a closing report, or if it's a palliative care request. And just checking the box does not meet the requirements for requesting palliative care. And again, you're going to need to contact the MRT or look at the rules to see the rules around palliative care. So we talked a little bit, I hinted towards certification. So this is a little section about the certification. So chiropractic physicians, naturopathic physicians, nurse practitioners, and physician assistants must certify to the Department of Consumer and Business Services, which is WCD, or part of WCD, WCD is a part of DCBS, okay, before they treat any patients with Oregon workers' compensation claims. And so when you certify, you're basically going to go online and you're just going to watch an introduction to workers' comp. It's going to give you information about the employer injury program, a handbook specific to specialties. So if you're a chiropractor, it'll be specific to that. And then you're going to complete the online statement of certification. So keep in mind, again, insurers are not required to pay you for any medical services you provide before you certify. And then to certify, you go to this link we have at the bottom, which is also going to be found on that main homepage we took you to earlier. So it's really important that you do this, and we do get some disputes occasionally for chiropractors that haven't certified, and there's really nothing in the rule that would allow them to get paid if they have not certified. From what I understand, it takes less than 30 minutes and you're just going to sign the certificate at the end that says you reviewed this, the information on that web page. So it's pretty simple, and it's very worth doing. And even if you don't plan on treating, right away workers' comp, it's always something good to have.
Sometimes you don't know when a worker comes in, you may not initially know that they have a workers' comp claim. So it doesn't cost you anything to be certified, but if that worker has, or if that patient has a work comp claim that you were not aware about, you will at least be covered. If that turns out to be a claim that is workers' comp, you'll at least be paid if you're certified.
Okay, so this is that same web page again that we showed earlier. And then what we're going to do here is show you how to get to the certification. So do you want to use your mouse to kind of point out? So here, if you click to the next slide, so you're going to go to this main page, Oregon Work Comp Doc, and then you're going to see on here on the left-hand side, there's a link that says certification. So once you click that, if you go to the next slide, right there, it'll say must certify, and then you're going to click on that must certify. That looks purple on our screen, and that's going to take you to the website that will show you everything you need to do to certify. Remember, all certification is done electronically, and it's as simple as following the steps, reading the information, and clicking, digitally signing or clicking that you certify you have read it. Okay, so now to the meat and potatoes here. What is a compensable medical service? So it's care for the accepted condition, and it must be authorized by the attending physician, and you, if you are a chiropractor, and the attending at that time. And after the accepted condition is medically stationary, there are limits for medical services. So you'll have to look at ORS 656-2451C to determine what those are. So remember earlier I told you there were some specific excluded treatments in workers' comp. I'm just going to give you a couple examples of those. And again, you can see these on OAR 436-009-0010. Section 12. So they don't have to pay for prolotherapy like I mentioned. Let's see, PRP or platelet-rich plasma injections, thermography. Yes, that sounds much better. Thank you. So there's a whole list. There's not really that many on there. And then there are certain disc replacements, for certain levels. So basically, attending physician responsibilities. So once a worker comes to you and says, hey, I want you to be my attending, you submit your 827, and then what do? So you would be responsible for authorizing temporary disability, prescribing and monitoring ancillary care, and specialized care. So no later than 5 days after becoming a worker's attending physician, or would you submit the Form 827. And regardless of whether Form 827 is filed, the facts of the case and the actions of the provider determine if the provider is the attending physician. So we have a certain kind of dispute that's filed called a CAP, or a change of attending physician. And the worker can only change twice after their initial choice. So we will look at that 827 that you submit and see if you are the attending based on that. And if you don't file an 827, but you're treating the worker, you're referring them for services, and you're authorizing time loss, without an 827, we might still classify you as the attending. So it's really helpful to get that 827 in so we can say, okay, this is pretty clear, this person, this physician is the attending physician on the claim. So type A and B attending physicians, which there is a, let's see, there is a matrix at the end of our rules that show you what type A and B attending physicians are. But you are, as a chiropractor, type B physician. So you may authorize temporary disability and manage services, but there are limits. So you can do closing exams, or you can choose not to do a closing exam and send the worker out for an independent medical exam for a closing. So you are allowed to establish impairment findings for permanent disability. So the other specialties in type A, B can't do that. Or actually type B can't do that. Type A would be MDs, DOs, those kind of doctors. Okay. As the attending, you would also be asked for your input if there is an independent medical exam. So they would ask you for a concurrence, or if you didn't agree with the IME, you'd have to explain why. And when authorizing time loss, the patient needs to be seen every 30 days. So time loss can't be just open-ended. So this is really important here about chiropractic physicians. So there are specific time frames where you can be the attending physician, and that is 60 consecutive days or 18 visits, and you can authorize time loss for up to 30 days. So if you've authorized time loss for 30 days and the patient continues to need time loss authorized, the patient must choose a new attending physician or an authorized nurse practitioner, and it can't be another Type B provider. It would have to be like an MD or DO. So if you authorize time loss for 30 days and the patient no longer needs time loss, you may continue to treat as the attending physician for the remainder of the 60-day or 18 visit. So if you've treated the worker and your time frame is up and you can no longer be the attending physician, you don't have to stop treating. Basically, the patient would go back to a Type A provider, typically an MD, establish that doctor as their attending physician, and then that doctor can refer the patient back to you for additional chiropractic care if the doctor thinks it's necessary. So one thing that is confusing sometimes about the 60-day 18 visits is what it really means. So it is all inclusive. So that means it doesn't start over with each provider. So let's say the patient started somewhere on January 1st and they treated with a Type B provider, let's say another chiropractor, until the 8th. So they've already used up 8 of their days. But they switch on the 9th to a different chiropractor. So on the 9th, the 60 days does not start over. It's just a continuation from the very first time they sought treatment. So if they're coming to you and you know that the patient has already sought treatment somewhere else, you need to make sure that you're still authorized to treat that patient and be the attending or to see them without a referral. So you always want to say, okay, am I the first provider that you've been to? When did you start with that other provider? Because you don't want to get yourself in a position where you're not paid for it.
If you're uncertain about whether the worker has been seen by a Type B provider previously, a good source would be to contact the adjuster that's managing their claim, and they should be able to tell you if they have had treatment.
Okay, so chiropractic attending physician, additional restrictions. So once the patient becomes medically stationary, you can no longer be the attending physician. However, you may continue to provide compensable medical services on referral. So that's kind of, we talked about that earlier. So chiropractors are not allowed to provide services for aggravations or reopening of a claim unless they're authorized by the attending. So basically, if there's an injury, they're done treating, the claim closes, and then they come back to you first thing and say, hey, I just need a couple touch-up visits. They can't do that. They have to go to an MD as an attending first, so establish care with an MD, and then that person can refer back to you, and then it kind of gets in a situation where there has to be a written treatment plan at that point. So treatment plans are necessary for ancillary providers, and ancillary providers are considered physical or occupational therapists, chiropractors, naturopathic physicians, acupuncturists, those types. So when an attending physician, specialist physician, or authorized nurse practitioner prescribes the ancillary services, unless an MCO contract specifies other requirements, the ancillary provider must prepare a treatment plan before beginning treatment. So what is a treatment plan? So the treatment plan must contain the 4 elements: objectives, modalities, frequency, and duration. So you must provide a treatment plan at once, and this again is on if it was on referral to you from an MD and you're not the attending. So you must provide a treatment plan within 7 days to the insurer and the referring physician. If you continue to treat beyond the duration outlined in the treatment plan, you will need a new referral. So you can't just say, well, I have 2 visits left, you know, it's supposed to end on January 1st, but I have 2 visits. I can just do those. You don't want to do that because you might not get paid for those additional visits, even though they were in the original plan because they're outside the time frame scope or the duration. So once a treatment plan is sent to the attending physician, he has 30 days to sign it and return it to the insurance company. So here's the caveat there. If the attending does not sign it, it doesn't affect your pay, but you need to make sure that you do your treatment plan within 7 days to cover yourself as regarding payment. So referrals. So if you're the chiropractic attending physician and you need to refer the patient to another provider, there's nothing that says you can't do that. So you just document it in the chart notes and what type of service. So, and indicate if it's for a consultation or for specialized care. So you can refer for therapy, like physical therapy, massage, acupuncture. It's just your standard referral that you would use for everybody. Again, if it's or you can refer to a specialist. Say you think they might need to see a surgeon just to get an opinion. You can do that. And then that you would remain the attending physician. And you would be the one that would still be prescribing time loss and whatnot, as long as you're within your 60 days, 18 visits. Okay, so if you prescribe ancillary care and receive notice that the worker has become enrolled in an MCO, or if you declare the worker medically stationary, you need to communicate these changes to the ancillary provider, or it's likely they won't get paid. So you can also log onto the insurer's online portal if they have one. I know that SAFE does, I believe Sedgwick does, to check the status, ask the worker the status, or contact the insurer. And I think that Stephen and I are both former claims adjusters, and we can tell you that communication with the claims adjuster is going to go a long way to making sure that you're doing things correctly. So whenever you have any questions, contact the adjuster and try to, get the answers to your questions before moving forward. So let's talk about closing exams. If you've had the patient, and in your case as a chiropractor, let's say for 50 days, and you think that they're medically stationary, you can do a closing exam. And a medically stationary in workers' comp means no further material improvement would be reasonably expected from medical treatment or the passage of time. So the attending physician at that time would do a closing exam and rate any impairment if there is any. Closing reports must be submitted to the insurer within 14 days of the date the patient is declared medically stationary. And as I stated before, you can refer the patient out for a closing exam. If it's a medical only claim, typically there isn't a full closing exam, but your chart note must indicate that they are medically stationary, they can return to regular work, and that there's no impairment. You don't have to do a bunch of technical stuff to do that. But if there's time loss, it gets a little bit more complicated, and you might want to look at our website to make sure that you're doing things the way you should be doing. Okay, so managed care organizations. So as I stated before, there's probably about 4 different ones, and each one of them has their own contract with the insurer. So you're always going to want to ask at every visit, because the insurer can enroll the patient at any time if the patient is enrolled in a managed care organization. If you have treated the patient and they get enrolled, the insurer should send you a copy of the enrollment so that you'll know. But if they don't send you a copy and the patient is enrolled and you're not following the MCO rules, it's kind of on you. So you need to make sure and do this. So if you refer an MCO enrolled patient, you must make sure the provider you are referring to is also on the MCO panel. So off-panel referrals need pre-approval by the MCO in most cases. So many MCOs require pre-certification of medical services for enrolled patients. So you should really find that out before you get too involved there. So if you have a history with this patient, let's say the patient has come to you, within the last year for something unrelated, and they come to you for a back problem. So you have an established relationship with this patient, and you have a history of treating the patient prior to the workers' comp injury, then you may continue to treat the patient as a come-along provider. So the MCO would send you a letter that says, hey, I see you're treating this patient, you've treated them previously, and they can certify you. They don't have to, but they can. But if they certify you as a temporary MCO provider, you have to follow all the MCO's terms and conditions to remain that provider. So they need to be, and this needs to be approved prior to the treatment beginning. Okay, Billing 101. Do you want to do any of this one?
Sure.
Okay.
So an employer cannot pay you directly unless they are self-insured. Therefore, you always must bill the workers' compensation insurer and not the employer. You want to charge the usual fee that you charge to the general public. You want to make sure to use CPT codes and/or Oregon-specific codes. If there is no CPT or Oregon-specific code, then you want to use the appropriate HCPCS code. All of your billings must include legible chart notes describing the services provided and identify the person performing the services. You may not charge a fee for providing the chart notes with your bills. However, if the insurer requests additional copies, you may bill for the copies using Oregon-specific code R0001, or if it's done electronically, R0002. If you are asked by the insurer to prepare a report or review records other than your own, then you can bill the insurer for that by using CPT code 99080. You want to make sure to indicate the actual time that you spent. If the request comes from the insurer must pay you, even if the claim ends up being denied. You want to make sure to use codes according to the services you provided. Submit your chart notes during the global period following surgical services, and bill the insurer as well. Add-on codes require a primary code, so you want to make sure to have that primary code listed, and you want to avoid unlisted service codes if at all possible. The form CMS 1500, or also known as the HCFA, is the standard billing form for workers' comp. You want to complete as much information as possible. Also, when filing a dispute for billing, that would be filing a dispute with the Medical Resolution Team, or MRT, you want to send the HCFA with the form 2842 so that we can see what was billed and how it was billed. There are payment limitations noted in OAR 436, 009, 0010, 11. You can refer to that if you want to find out what those limitations are. But they provide specific times that a provider may not bill insurers or workers. Completing the form, the 827 forms, and let's see here. These ones, right? The following items are ones that the insurers are not required. You cannot bill the insurer for these, and that is completing the 827 forms and the 4909s, providing the initial chart notes with the original bill, preparing written treatment plans, supplying progress notes that document the services billed, completing work release forms or completion of a physical capacity evaluation, also known as a PCE, when no tests were actually performed. And then more than 3 mechanical muscle testing sessions per treatment program, or when not prescribed or approved by the attending physician or authorized nurse practitioner.
Okay, so I'm going to do this one because we're going to cut some of this out because we've already talked about it. So you never bill the patient unless certain things occur. And we talked about those earlier. And for example, the patient seeks treatment for conditions not related to the workers' comp claim, or they're an MCO and you're not on panel. So here's the thing that is important to note. As of April 2019, you can bill the patient for missed appointments in certain circumstances. So you can find those at OAR 436 009 0010 subsection 13. So in general, what this says is that the insurer does not have to pay for no-shows except for arbiter exams, independent medical exams, and worker-requested IMEs and closing exams. But a provider may bill a patient for a missed appointment if, now it has to be exactly like this. So the provider has a written missed appointment policy that applies not only to workers' comp patients, but to all patients. The provider routinely notifies all patients of the missed appointment policy. The provider's written appointment policy shows the cost to the patient, and the patient has signed the appointment policy. And enforcement of the policy is a matter between the provider and the worker. So WCD will not be responsible for enforcement. So if you file a dispute because somebody missed an appointment and you had all those things done and they just haven't paid you, we're not going to do anything with it. We're going to send you a nice little general letter that says, hey, the rules say we don't get involved in that. So that's something you'd have to do with the patient independently of workers' comp division. So the next stuff is, I have some billing questions on here, like when can you bill private insurance? I'm just going to skip over some of these, but click again. So you can only bill the insurance once you have notice of a claim denial. So that should come from the insurer once they deny the claim, and then you could bill the insurance or bill the private insurance, or if what they're treating for is not related to the claim. So a closed claim does not automatically mean the worker is not eligible for ongoing treatment. So you need to just make sure that you are talking to the adjuster about what happens after the claim is closed. And for denied claims in litigation, make sure that you continue to bill the insurer, but also send the bills to private insurance. If there's a settlement, what the insurer will do is take all the bills that are in file and agree usually to pay those. So if you haven't been billing, you're not going to get your bills paid, and there won't be much you can do about it after the legal document has been drafted. So the next, we've gotten these billing questions from various providers in the past. That's why I'm going over them with you. So initially, the billing period is the same for all workers' comp claims. So you have 60 days from the date of service or from the date you found out it was a workers' comp claim, or after any litigation affecting compensability, to submit the bill. And that's why you should really just be submitting them all along. So when a bill requires a correction, you have 1 year from the date of service to resubmit the bill. Once you submit a bill and it has been denied or reduced, and in your opinion it shouldn't have, you have 90 days to submit that dispute to the medical resolution team, or if you do submit it, it will be untimely and we won't be able to help you at all. So if you know it's a workers' comp claim, you cannot bill the private insurance at the first visit or in conjunction with the workers' comp billing. So you can't do double billing. So then, number 5, can we give the patient a form to fill out and return asking us for their claim information? Yes, please do. That's how you're going to get everything. So we encourage you to have the worker complete the information form so you have all the information you need at the start, and even as the claim progresses, if anything changes. So if I were a provider, I would give them a little form to fill out with their claim number and whatnot, everything that they know. And then I would ask them at every visit, has anything changed? Maybe every few months I'd have them re-complete that form just to make sure they haven't been enrolled in a managed care organization.
Make sure to save that in their file, and then in the event that you do file a dispute, you can send that information to the medical review team.
Yes, it's all about documentation. Okay, so these next few slides are going to show you about Oregon fee schedules. We get a lot of questions from people calling in and saying, hey, what's the fee schedule for this? I can't find this fee schedule. So you should know where to find the Oregon Workers' Compensation fee schedules. And just, currently the auto insurance uses the same schedules as we do. So these schedules are used to determine the maximum amount an insurer can pay on any given service or code. You bill the same as you would normally bill anybody, but workers' comp can only pay this much. So if you bill under the fee schedule, that's what you're going to get paid. But if you bill over, you're still going to get paid just the fee schedule. So these next slides kind of show you how to get there. So do you want to do this one? This next, how to get to the fee schedule?
Sure. So once you click on the medical fee schedules, you'll have the option to go to a calculator or a schedule table. Personally, I always use the calculator. So here's the fee schedule, and I
always use the calculator as well, which is the one in purple. You can also use the fee schedule table right below it.
Yeah. Let's see.
Once you click on that, the next thing that's going to come up is this disclaimer.
Disclaimer, yeah. You're always going to have that. You're always going to want to accept it. Let's see, this page lets you choose what service you need for the fee schedule. So for example, the physician fee schedule Chiropractor bills are going to be found, or your services are going to be found under the fee schedule. If you have durable medical equipment, that would be here, and then for ambulatory surgery centers, they would click here. Here in this example, we chose the physician fee schedule, and this is the physician fee schedule calculator. It's very simple to use. You basically enter in your service code here, the date of service. If there is any modifier, there's a drop-down box here that you can select. You can add a row, so if you have multiple service codes you want to check, you can add as many as you want in here, and then you just calculate. And then this is what comes up. It tells you the procedure code, that there was no modifier, the date of service, the non-facility fee, which is usually going to be services performed in your office. Facility fees are usually going to be performed at a hospital or a nursing home or an ambulatory surgery center, just to name a few.
Do you want to do this one too, or?
Sure. So MRT dispute. So when you have, when we talked in the beginning about the MRT or medical review team, if you have a dispute about billing medical services that also include disapproval of therapy or surgery or referrals, or perhaps the adjuster just is not responding to you, you can file a dispute. We do handle disputes from injured workers regarding worker reimbursement, for example, also from insurers, attorneys, worker attorneys, and providers. Those all can submit requests for review for a dispute. This page here is where you would go if you needed to file a dispute. You would go to the Workers' Compensation Division website, which is right up here, and you would want to click on Healthcare Providers, and then in the left gray column, you're going to want to click on the Dispute Resolution.
So you guys will notice it's the same web, beginning web page for everything we've done so far. So this is going to be really handy to write down the OregonWCDoc.info.
Here, this page is going to give you more information about what type of dispute you can file, and it also provides the link to the form 2842, which is right here, and also 2842A, which enables you to list the specific CPT codes and dates of service that are in dispute. A few tips. You want to make sure that anything that you submit is legible. You want to submit both the 2842 and 2842A if the issue is regarding a billing issue. You want to send us all documentation that you have, such as the HCPAs, any EOBs. If you have submitted and received an initial EOB rejecting payment and you request reconsideration from the insurer, they send you another EOB. We would like to see both of them. Basically, any notes or emails showing what you have done to attempt collection. You do want to make sure that you are within the deadlines. You have 90 days to file a dispute with the medical resolution team after the EOB is issued. And most importantly, if you have any questions, please give us a call. We usually can answer a lot of questions by telephone, and that may save you some time.
Okay, so just a quick note for y'all, we actually do not handle claims that were under jurisdiction outside of Oregon. So, nor do we do like U.S. Postal Service, those kind of claims. So these are federal claims. There are longshore and maritime claims, and because Washington is the closest to us, we do sometimes get claims for Washington, and we don't handle those either. So there's some contact information here for those different jurisdictions that are very useful to know. And if we got a dispute, received a dispute regarding one of these claims, we would just send you a letter that says, hey, or even call you and say, hey, we don't have jurisdiction on these claims. We can't do anything, so you'll have to take them elsewhere. So one thing that we need to make sure and tell you is that we provide free training. So we'll provide any type of training regarding workers' comp. that you need in order to help you with your workers' compensation patients. So we offer training on, more inclusive basics, workers' comp basics, billing, dispute processes, etc. And we custom design the training to fit your needs, whether it's in person, webinar training like this, or we can do informational telephone calls or whatever you need. I know there's a lot of offices that are just starting up, and we'll go and help them, or if you have a new billing specialist, we can help them specifically. We can also just, answer calls on the telephone if you just have specific questions. And we are always here Monday through Friday to help with all of your workers' comp needs. If we don't have the answer, we can send you somewhere else and get the answer if we need to do so. So as you can see, there's our phone numbers and our contact information. And we appreciate your time, and we thank you for watching. Thank you so much.